welcome everyone. My name is Jeremy Anderson Sloan. I'm the AVP for Institutional Advancement. I want to thank you for joining us today as we dive into the art of fully engaging with clients in initial appointments, brought to you by BioLounge. Joining us are two UWS alums from BioLounge, Megan Barnett and Ashley Koch. Megan is an experienced functional medicine provider, certified nutrition specialist, educator, and co-owner of BioLounge. She brings over a decade of experience in nutrition science and holistic health. So welcome, Megan. And Ashley is a functional medicine provider, certified nutrition specialist, and educator dedicated to providing personalized care to clients of all ages. So I'd like to now give the floor to Megan and Ashley.
Wonderful. Thank you.
Jeremy.
Yeah. All right, I'm going to share my screen. Bear with me. All right. Can you see it?
I can see it. I think
Yes.
we're good.
All right. Well, we're excited to be here. We're going to start out. We had a great introduction getting started. So I think we've covered most of this. I don't know if there's anything you want to add here, Megan.
No, I think we can breeze through the bio.
Okay.
Yeah.
Great. So let's talk a little bit about BioLounge so you can become familiar with our work.
So we are a functional medicine and longevity clinic in Northwest Portland. BioLounge was started by Jeff Grimm, who's a nurse practitioner. He came from a more allopathic background originally, and then he had the opportunity to build out the functional medicine wing of a regenerative stem cell clinic. And he was still taking insurance at that time, and he realized how much restriction he had around providing care to his patients in that model. And so he was prompted to open BioLounge almost 6 years ago now, with the intention to be able to provide unencumbered care to people that maybe are suffering disease, have symptoms, they don't know what the disease is or what's causing it, or people that are trying to reverse or prevent chronic disease. And so shortly after he opened the clinic, I joined forces with him. And we found that the relationship between a functional medicine provider and a functional nutritionist was really pivotal for making meaningful change with our patient population. And much of that was driven by a curiosity or an investigation-based approach, whether we were investigating something that they were presenting or something they were preventing. And so we are very personalized, as one is in functional medicine. Obviously, there's not a one-size-fits-all. And we do a lot of measurement through patient symptom tracking, as well as metrics using a diversity of labs and diagnostics. Ashley and I do work with people all over the country because we're unencumbered by state licensure in most states. And I think one of the things that differentiates our approach at BioLounge is that we're incredibly collaborative. Not only do Ashley and I have the benefit of working with medical providers within our own four walls, which is very fortunate, but we do a lot of collaboration with specialists and other providers within our city and throughout actually all of the states that we work, so we can provide more comprehensive care to each one of our patients. And I would say one of the other things that is at the foundation of our mission is education and empowerment of our patients. So we are not aiming to be the experts that tell them what to do and hope they follow along. What our goal is to educate them so they feel empowered about their own health, and they can take the bull by the horns as they progress. And we do see patients of all ages and all conditions. So yeah, we Ashley and I are pretty fortunate for where we landed. We get to do a lot of fun and collaborative work together through BioLounge.
So in terms of initial appointments for us, we feel like this is our moment to really make our mark with the patient so they understand what they're doing, how they engage with our work. And so for us, we love this quote, two things remain irretrievable, time and a first impression. And so we want to really help you understand how to get the most out of that first impression so that your patients keep coming back and talking about you. In terms of making an impression, I really like to focus on how you see yourself as different from other clinicians. So many of our clients come into our office and they've been to a bunch of providers, or in our area, there's a lot of naturopaths, and they've been trying to navigate what's going on in their body and they want answers. And so what really sets you apart and what makes you unique is how you're going to make an impression with these clients. And also the relationship you have with them. So how do you craft that relationship? How is it going to look collaborative? What can they expect from you? And how are outcomes different? So often our clients come in and they've had a lot of symptoms. They haven't had success. They said they've tried everything. And they want to know and have hope that they're putting time and money and investing in something and they're going to have a different outcome than they've had in the past. So I think it's really important to think about how you're going to make an impression on them.
I think that with our degree, we have a differentiator in how we are able to approach our clients or patient population. We are fortunate, those of us that came out of UWS, to have an advanced understanding of biochemical pathways and how nutrition can affect those biochemical pathways. I think this is one of the things that often our patient population reports back to us is, yeah, I knew food was important, but I didn't understand that it was foundational to the pathophysiology or biochemistry of what was going on under the surface. We are also trained to have a deeper understanding of the connection between all of the systems, right? The mouth is not actually disconnected from the elbow. A little bit, but you know what I mean, right? There are connections between every molecule within our body, and we know how to tie those together, not only for the investigation, but for the therapies and treatment that we apply. I think that our ability to carve out more time with our clients allows us to do a deeper dive. If we use our time wisely, starting with that initial consultation, we can go deeper and build a stronger understanding about what may be behind their symptoms or their goals. One of the things that comes up a lot is how we listen and how we ask questions. And so understanding the tenets of motivational interviewing, understanding how to connect with our clients and pull information out of them, right? By going one layer deeper with our questions allows us to be more effective. And showing up to each appointment with curiosity, compassion, and perseverance is the key. And I know that what we hear back from our clients on a regular basis is that we relentlessly pursue answers for them. And that makes all the difference in the world to their experience with us.
So one of the things we do before we go into an initial appointment is really our preparation. So we have an extensive intake form, which looks very similar to a lot of the functional medicine intake forms that are out there. And you can personalize them and really add as you practice what you think is the most valuable. But before the appointment, we read the intake forms and we identify gaps, like areas where we feel like we don't have enough information or things that might have come up in that intake form, but really we need more robust information. And as we start charting in our system, we might start putting questions in there for the conversation that we want to remember to ask, because we've looked through that intake form. We have a sense of who this person is. We want to make sure we cover certain things. And then as they're walking into our space, we often take the time to mention something personal. So they might have listed something on their intake form that was personal that you can connect with. Like, I saw you were recently traveling, or I saw you have a daughter. What grade is she in? Like, really building that connection as they're walking into that appointment with you so that they understand They took the time, sometimes 20 or 30 minutes to fill out the intake form. And then you also took the time to actually use that information. And that's a great way to start that relationship.
So getting organized before the appointment allows you to show up not only prepared, but confident in your own right, because you're ready to go in based on what you've already done, all the work you've done before. So one of the things that is a common practice for Ashley and I is to review all the paperwork beforehand and start our chart note. And so that can be integrating the intake information into your chart note and then making notes about questions you may have, et cetera. So you're kind of building out your format for how you want this conversation to go. Won't always follow that format, but you're creating that scaffolding or structure for yourself. And it reiterates the information that you've read in your mind as well. We use a template for our intake. So based on most software, you can create dot phrases or quick text where you just push the dot and, start typing in and it'll fill out all of your information that you want to make sure you have for prompts. And Ashley and I use that. So everything from the systems we're trying to cover to the timeline we want to go through with them is already auto-populated into that chart note before we see them.
Yeah. And so building your template, so taking the time to really think about how you want your appointments to flow, it can be nerve-wracking. I remember first practicing. I graduated 3 years ago. And so I remember the nerves of coming out and practicing in every appointment and not knowing what to expect when someone walks in and sits down across from you. And so this template really gave me a lot of confidence. And so often we start out our appointments and the first part of the template is like, what are the reasons and expectations? So they might have put that in the intake form. Like we have a question, like what are the top three things you're hoping to accomplish with us? And so I've typed those in, but I'm going to ask them right at the beginning, like, what are you here to accomplish? Like, what brought you to this appointment? What are you hoping to do? And so that's going to be the starting point. And they'll start going in a lot of directions. Like they have migraines and digestive issues, and they'll talk about the major things that brought them there. And then the next part of our template is really health and social history, really getting a sense of what's going on. So do they have any diagnosis, the family history, which I've copied over from the chart notes, thinking about social dynamics. So who do they live with? Do they live alone? Do they live with others? Do they have pets? I'm going to ask them about their living situation. Do they have any water damage or mold in their house? Just really getting a picture. What is their work life? Do they work long hours? So that I have a sense of who this person is. And then there from the template, I often go into current nutrition review. So I ask a lot of questions like walk me through a typical day of what you're eating and drinking from morning to evening, and building that out and asking more specific questions around that. And then getting a sense, do they have previous labs? When was the last time they ran them? And then we jump into reviewing lifestyle factors and symptoms and building out the health timeline. So it becomes a combination of that, functional medicine matrix and the functional medicine timeline that's really built into our template, and we can cover that in our intake process.
So reviewing with them why they're there is essential. It's in our intake paperwork. So we have an idea. We say list your top 3 goals, and I think we have a separate section that says list your top 3 expectations from this first appointment. So we're trying to identify, okay, what is the expectation for today? What do you want out of this work long term? But it's important that you clarify that information. For one, it's important because they may, after they've started to talk to you, they may start to shift why they're actually there. But it also helps you create connection as you dig into their motivations and their goals. One of the things that I think comes up a lot is as a practitioner is you listen to their whole story and you have a goal. You decide you have a goal for them. It's really important as a practitioner to go back and reiterate what their goals are, because your goals don't really actually matter. Although it's hard not to focus on what you think they should be working on based on their health history, right? So connecting with them on what they want, and then identifying what they're currently doing. Are you already doing things that promote your health? What are those things? We ask about 3 things that are part of their normal routine. And then 3 things they're doing that maybe decrease their health. These are things they already identify. They already know maybe working against them. It's important that They share that with you, and then you disarm them, right? Like, we all have those habits that are not necessarily health promoting, and then it allows you to dig into what they may be willing to change.
So building a partnership is really key in this initial appointment. So what can they expect from you? What brought them here? You have a sense of that. One of our favorite questions is the magic wand question. So if you had a magic wand, what would you change? Really understanding that, and that can give you a sense of their motivations. And sometimes it can go in a lot of directions. It's not always what you expect. Another question I really love is, when was the last time you felt well? Especially if someone's sitting in front of you talking about a bunch of symptoms that are really frustrating, going back to a time when they felt well. And then if they find that time, which some do not find that time, but some do, then what was happening in that time that was different than what's happening now? And sometimes they'll build their own roadmap back to health for you right there. They'll tell you, at the time I was very active, I had a great relationship, I had a community, I might have been eating really well, I was doing the Whole30. They're going to start identifying things for you that might have gotten them there. So that can be a really good question. Another question I like to ask is, what are your long-term health goals? Because they can tell you why are they there today, and they're working on certain symptoms or things. But if you understand their long-term health goals for the future, after you clear up some of the major things impacting them, it's going to give you a roadmap for a long-term relationship. So that you can really think about, how do I go from this care of dealing with the symptoms to then helping them with their long-term health goals of where they want to go. And then understanding what they consider a good working partnership. What are they looking for? What kind of support they need? How often are they needing to see you and interact with you so that they can be successful at the plans and the things you're putting into place?
Okay, so our next step is diving in. So oftentimes there will be an initial review of symptoms or their history, and then you have an opportunity, and as time allows, to pick it apart a little bit. This can happen in the timeline. Sometimes, we're trained to start at the very beginning, right? So when they're born, and then talk about their mother's health, and what is your health in the first couple of months of life, and did you have chronic ear infections, and all the things we're thinking about may be underlying their health today. But I think more importantly, this is looking at these conversations and thinking, what do I need to know more about to do my job better? Because most of us come out of school a little hesitant to do this job, and then carrying a large suitcase around called imposter syndrome, we can feel like we get in these appointments and we need to get through the appointment and make sure we don't forget anything. Well, I would encourage you to think more about what you would be doing if you were sitting in front of a friend that was telling you something really salty about their life, right? You're like, and then what? And then what happened? And if you can go in with that mindset, you actually have a stronger relationship. You get lost in their story versus it being about you being in that room with them. And it allows you to pull out layers upon layers of information. And when you practice that curiosity, you have a much bigger story to work from when you then put on your investigator hat and try to figure out what's going on or what you need to know next from a testing perspective, et cetera, for your next step.
Yeah. And I think that's actually one of the things that really sets us apart as providers when we're in that room. I had a recent doctor who runs a big hospital team and went through the intake process, and he was surprised and excited. He's like, I can't tell you the last time I encountered an extensive intake process, because that's not something allowed through insurance in their medical practice that they can actually do. And how relieved they were to actually have someone sit down and take this 75 minutes to really learn about their health journey so that they can put the pieces together. And he was having aha moments about his own health by having the time to really build out this timeline. So I think having that curiosity will really set you apart in your appointments. And don't be in a hurry, and don't be afraid if you miss something, but try to be present in that experience. So by the time you've gotten this far into your initial intake, you should really understand a lot of lifestyle factors. And so this is a part of our template. We really have a picture of their sleep. Like we'll ask them, tell me about your sleep life. Are you waking up feeling rested? Do you stay asleep? We ask a lot of questions about sleep. We dive into stress and what stress management tools exist, because we all know that stress is just as important as quality food. We understand their movement patterns. How often are they moving? Are they unable to move because they're in pain? We get a sense of inflammation and pain and any places they're having pain on their body. You break down their allergies and their digestive tract from beginning to end. We have a lot of questions about the digestive tract because so often our work starts in the digestive tract. You should have a sense of their hair, their nails, their oral health, their hormones, their brain function, and their energy levels. So really getting through those key lifestyle factors. And those are often the things we come back to. So when you have a follow-up appointment or a lab review and you've asked them to do some things and they come back, like they might tell you, oh, I've noticed this is going really well, or I haven't really noticed a change. And then you start diving into how's your sleep been? How is your stress? How is that pain in your knee that you described to me? And then they start realizing, oh, the pain in my knee is actually gone. I haven't had it in weeks. Oh, I've been feeling like I'm adapting to stress so much better than I used to. So having this journal is a really great way for them to really see the value of the work with you and remind them, because sometimes they will forget all of the things that they complained about in their previous appointment.
Yeah, I'll tag on to that by saying when I see a person for a lab review after that initial consultation, I copy and paste that section from the initial consultation into my chart notes in preparation for the lab review. And that is done if I've made any changes. So oftentimes, Ashley and I send people out the door at the initial consultation. They've got a couple of things they are going to work on. So then I'm going to review. Did any of these things change? Then after the lab review, I'm going to copy and paste that into the next appointment, again, because I'm tracking their symptoms for the subjective improvement before I'm able to track their objective data, because it takes a while to do another set of labs, et cetera, et cetera. Okay, so connect and educate. When Ashley and I are in the initial consultation and we're hearing the stories that they're telling us, and we're starting to pick up on little clues, we're formulating hypotheses as we go along. So we start to try to tie things together so we can decide what steps we need to take next. If they're sharing something around gut issues and they had 4 sinus infections the year before, right? We're going to be thinking about, okay, we need to be thinking about the microbiome. Were they treated with antibiotics? Do we need to do advanced testing there? Is there an intervention that we can start right away to try and support them? We are trying to build an understanding of our patients' health to them. Sorry about the dogs in the background, everybody. Hope you can't hear that too loudly. What we want to know, what we want to share with them is, oh, when you tell me this and you tell me this, it actually might mean this is happening. And then I can afford to finish this, so I'll figure out when we're going to go.
All right. All right, we lost Megan to the dogs for a moment. So I think here is really helping them connect the dots. This is the moment. So, I had a patient this week who came in and she has been struggling with digestive issues. And so she now needed to use a chronic PPI to deal with the digestive symptoms she was having. And as a result, she was also having headaches. And she thought all of these things were very separate, but she had hormonal headaches. And so she wasn't digesting well, having chronically loose stool. She had hormonal headaches, frequent migraines. And then as you broke it down into her hormones, she had tons of symptoms around her hormones. And so connecting the dots and helping her understand that it was the headaches are connected to the digestive issues and the gut health issues she was having, which is connected to her hormones and her liver's ability to detox hormones. And so helping her understand, if we deal with all of these things together, we can have an impact on those symptoms. So helping them understand that aha moment of, oh, these are connected. These are not separate. These are not unique things that are happening. Like I should chase my headache, and then I should chase my digestive issues, and then my PMS. They're all happening together, and there's a connection. And so helping them learn about that connection, because when they leave your office, they're going to remember that education. They're going to remember the time you took to help them build the connection in those. And that's how you're going to have an impact on them. Also, I think Megan talked a little bit about this, but what are the triggers? So sometimes you go through that timeline, or you go through moments. Like I noticed in an appointment with someone, everything kept leaning back to this one time in their lives, and everything pointed to that. And then I asked them, like, is there something that happened around that time? And they had a moment where they realized like something did happen to them, and they really understood that their health shifted after that moment, or after they went to college and lived in a dorm room that was filled with mold, and then all of a sudden they're having all these health issues. Like helping them build the connection and finding their own triggers. Sometimes they will identify it for you, or sometimes you will help them do it. All right, so now
I'm going to pause you just one second, because we do
Yeah.
have a question in the chat.
Oh, great.
So are we okay with taking a little break and answering that?
Yeah.
So the question is, where do you suggest building the intake template? Have you had success with certain EHR software that's appropriate for private practice nutritionists? Anything out there? Then practice better. So because we're in a medical practice, we use a charm, which is kind of overkill if you're doing nutrition without having a medical provider. A lot of the people we are working with in our clinical immersion program are using Practice Better, and they have had good experiences with it. We do build our template within our EHR, and that way it's able to just be auto-populated in every chart note that we need it for. But when we were building it, we were looking at other medical, we combined a lot of information, because obviously not all medical intake forms are looking at lifestyle factors, nutrition and sleep, et cetera. So we took a skeleton and then built it out from there within the EHR. Did that answer the question? Just want to make sure. Ashley, do you want to add anything on to that?
No, I think that's great. I know there's a lot of new tools out there like Living Matrix and all of these that try to make those templates for you, but I've found it pretty easy to, if you chunk it into a couple different templates, like we have 3 or 4 templates that we're going to hit a couple buttons and populate in different sections as we're flowing through appointments. And I feel like we're able to cover a lot of what you can get in those services that you pay for without needing them to manage all of your clients' information. But yes, most of our students are using Practice Better, and I'm open to learning about others, but unfortunately they seem to be the one. Oops. So building a plan. So one of the things we do as we get to the end of the appointment is really repeat back what we're hearing. So what are their priorities, right? So I understand you really want to address your digestive issues, and you're trying to deal with your hormonal migraines. And so I'm going to lay out some ideas I have for you and give them options. So we often call it the choose your own adventure moment for some of us who know what that is. But essentially you're going to give them all of their options, and they get to decide what they engage in. So we'll lay out some testing that we think will be valuable, and if testing's not an option, we'll lay out some experiments where we want to try based on the symptoms they're encountering to address what we think is going on. And so we're trying to do the fix what we find approach and deal with what they're presenting. So we lay out a plan, and then we create a timeline, a next step. So make sure you finish that conversation with what do we do next, so they don't leave your office and then wonder when they're going to see you the next time, because you want to keep that relationship going and give them the expectations. So whether you're seeing them again in 2 weeks or 4 weeks, really understanding what they have to do next to keep the relationship going and keep their progress and their momentum going.
I'm going to add on to that just for a minute, because I think this is the part of the appointment that stresses new practitioners out the most, right? You've taken in a lot of information, and now on the spot, you're supposed to decide what you're going to do with that information. So I would encourage you, when you first start, you don't have to know that at the very end of the appointment always. You can say, I think there's an opportunity for testing. If you're interested in testing, I always say there's the spend money now, test, don't guess, or there's the experiment, don't spend money now, but it's going to take a lot longer, potentially option for the patient. Do you want to go home and do an elimination diet? Do you want to go home and try these supplements because you're constipated and I know I can fix that with these 3 things, right? Or do we need the hard data? Do you want the hard data for next steps? And if you're feeling really intimidated, you can say, I'm going to lay out your testing options in your visit summary. And then I'm going to follow up with you in 3 days so we can decide what steps you want to take. Okay. That allows you to exhale, think about what you've just learned, and decide on a priority list. And then I still do this sometimes. I'll say, like, I think there's 3 tests that might work really well for you. I want to think about the most important. I'm going to put it in a matter of priority, and then you can make a decision about that later. If I don't feel ready to come up with that plan right away. And if you do, always remember that if they don't have medical labs for the last 2 years, that's a great place to start. And you don't have to know all the next steps. You're going to start with a broad overview. And then from there, you can go on to deeper testing if you feel like it's necessary. Okay. So identify trackable metrics. This is a safeguard for you, and it allows you to stay on track with them over your coming visits. So in the last bit of chart notes, I like to write what I would expect they will see for improvement by talking to them with regards to their own subjective observations, right? Better sleep, reduced headaches, higher energy, less pain, whatever. Sometimes, depending on what their symptoms are, it's really helpful to say, okay, well, where you are today on a scale of 1 to 10, with 10 being the worst and 1 being the best, where are you today? So you can actually put that in your notes. And that way, when you ask it again, you say, oh, you were a 7 on the scale last time. Where are you today? And then also, we want objective metrics if we're able to do testing. So how are we going to know that what we're doing, what our next steps that we have proposed to them is actually working? We're going to track, a CBC over time. We're going to track whatever, anything that you can actually track with actual metrics, glucose levels, etc. And so the next time you see them, you're pulling that up. And the next time you see them, you're pulling that up. And that allows them to not only say, oh, I'm feeling better, but my risk is decreased because now I have data.
So then one of the last things you want to do is really give them the support to go home. So what are you asking them to do? So maybe you're crafting the plan a little bit later. Maybe you're sending them out the door with something. So what can you give them in that moment that's going to have an impact on their health? So often people come in with digestive issues. So constipation's one we go back to. We have a pretty great tool belt for constipation. And so we can definitely send them out the door improving that. Or sleep is something that really can be impacted quickly. So if someone is having a hard time falling asleep and staying asleep, we might pull out something like melatonin slow release and focus on, we're going to work on long-term sleep, but right now I want to provide you this solution because sleep is important for everything we're going after. So walk them out the door with that tool. Stress, there's a lot of great tools for stress. So we have some really good supplements with adaptogens that we'll use in the morning or evening. So if you notice that stress is a major part of what's going on and you think based on how they describe their stress and the full picture of their health that it's playing a role, you could start helping them have some support from a stress perspective. For us, the center of what we do is often the gut microbiome. And so when we review what they're eating, I can't tell you how many clients are not eating fiber on a very basic level. We have a soluble fiber we use, Megan created. Most of my clients are walking out the door with a bag of soluble fiber because I know I have to start doing work in the gut and I'm going to continue doing work in the gut. So it's really easy to walk them out the door with something that is going to get them started and get them feeling good, and addressing something that's happening for them right now. And then walking them through what we can expect with the rest of the plan that you're going to create. So those are the highlights of how we really get through our initial appointment, but we're open to questions and conversations or any thoughts that you have and discussing that further. And then from there, I want to just send some resources in terms of how you can connect with us. So if you want to learn more from us, we have opportunities to learn and CNS supervision. So we have a learning program, our clinical immersion program. You can head to our website if you want to learn about that. We also have a free newsletter where we share client cases or free webinars. We share what we're actually doing in practice and navigating a range of different diseases and take you through our client profiles and get a sense of how we address it and resolve it. And then you can just email us anytime if you ever have questions. We know what it's like to be finishing our education or to be coming out in practice and being new to all of this and feeling like you're on an island by yourself. So email us if you ever have questions and you want to connect.